So good morning, everyone. My name is Tom Fott, Chamber President, and welcome to this information session on addressing the housing needs of seniors in Timmins, an update on the 1800 Riverside project with the Cochrane District Services Board. Please join me in recognizing that we are on the traditional lands of the Matagami First Nation within Treaty 9 territory. As we discuss the 1800 Riverside project, we acknowledge the importance of Indigenous partnerships, culturally appropriate services, and Indigenous-led solutions to support elders in our community. Together, we can create an inclusive space rooted in respect and reconciliation. As the region's largest business organization, we recognize the importance of early and meaningful engagement in community development projects that impact not only social services, but also economic growth and business confidence. Today's session is an opportunity to foster collaboration, ensure transparency, and explore how this project can best serve the needs of our community while aligning with regional economic priorities. We appreciate your participation and look forward to a productive discussion. There will be an opportunity to ask questions. Please raise your hand or submit your questions in the chat box. We do kindly ask that you remain muted until called upon for a Q&A portion of the session. We are pleased to welcome Brian Marks, Chief Administrative Officer of CDSB, who will provide an update on the project's progress and next steps. Brian brings valuable insight into the vision of 1800 Riverside and how it aims to address key housing and social service needs in our region. We appreciate his time and look forward to his presentation. Without further ado, I'll pass the floor over to Brian to provide his welcome remarks and updates on the proposed project.
Thanks, Tom. Welcome, everybody, and thanks for taking some time out of your day to attend this session. I'll just jump right in. So this first slide, I hope everybody can see it okay. Give me a thumbs up if you can see it.
All set.
Perfect. I'll give a little bit of background. As most of you are aware, 1800 Riverside Drive used to be the Ramada Inn. We purchased it, the DSAB purchased it last year to serve as the foundation for our application for Heart Hub, which was homelessness, addictions, recovery, and treatment. We were unsuccessful in obtaining the funding for that. And so we moved to Plan B. Plan B for 1800 Riverside Drive always was to serve as seniors housing. The DSAB has a very large portfolio, and you'll see some of that in a later slide when it comes to seniors housing. Actually, it is the bulk of our housing stock across all of the district and in Timmins as well. And so this is not new business for us. And given the current level of demand, this made sense that we would be able to turn this property into seniors housing to not only benefit seniors who are looking for housing, but also in a fiscally responsible way to turn a property that was intended for something else into a useful property that could actually generate revenue. And so you see the four areas we'll talk about: current housing context, understanding the current housing needs, looking at current demands, understanding impacts on housing development, and then we'll move into understanding the project specifically, and then talking about how the DSAB supports local, because I know this is dear to chamber members, and people often have questions about how the money is spent or where it's spent or how it's decided on how we spend it. So, and then we'll look at opportunities and next steps. So current housing context, and there's a lot more that we could provide here, but at a high level, we've got 701 total senior designated units. When I say that, these are units that we inherited in the late 90s as a result of local service realignment. And that was when the Conservative government of the day and the province of Ontario under Mike Harris downloaded services and actually resulted in the creation of district social service boards in Northern Ontario. Because there were no tax structures, there were no counties or upper tier municipalities in Northern Ontario. So they created 10 district social service administration boards to deliver services such as housing, childcare services, social assistance or employment and training, and also emergency medical services or paramedic services. And so when we inherited just over 1,200 units through the local housing corporation, and that was the merger of Cochrane North, Cochrane South, and the Timmins Housing Authority. Those three entities became the Cochrane District Local Housing Corporation, and 70% of that portfolio is seniors housing. So 431 senior designated units specifically in Timmins alone. And that just means there's a building mandate that we would house people over a certain age. That age level has changed over the years. It's actually dropped a little bit because there was a period about a decade ago, 15 years ago, when we weren't seeing the number of applicants that we wanted to see. And so that age limit was dropped in some buildings. Current housing demand, district-wide, we've got 2,100 people on the waiting list for housing. And that's for approximately 2,200 units, so almost a one-to-one. Turnover only occurs in our units, obviously, when somebody has to move out for some reason or passes away as maybe unfortunate circumstance. But with 70% of our housing dedicated to seniors, often it's people who are looking to move into long-term care or other supported facilities. And everyone knows the waiting list that's associated with long-term care right now. So those beds just aren't readily available. Or unfortunately, people passing away. So it is vacancy driven. And so that's why we have such a long wait list. Overall, there's 850 seniors waiting for housing and 420 in Timmins proper. Maybe before I jump into this slide, I'll just mention that one of the things that is important when it comes to seniors housing is recognizing the magnifier effect when it comes to employment. So when we look at what we provide at the Cochrane District, it's all considered to be independent living. So people can qualify to live in our units if they're able to live independently with supports that they bring. So for example, somebody can live in our units, a senior can live in our units and then go and apply for home care supports or other services provided through healthcare. The Cochrane DSAB does not provide healthcare services to the seniors. If they're not able to live independently, then they may not be able to maintain their tenancy. And that's where we would help advocate for them to go to a more appropriate setting, whether it's long-term care or some other supported environment. So 1800 Riverside Drive in particular, it was a really good option for Plan B, given the fact that it could be turned into just over 100 independent seniors units in short order. Short order being anywhere between 12 and 24 months. Anybody who's associated with larger construction projects, just look at the Golden Manor. These things typically take a longer period of time. And as you'll see, on the right side, at significantly more expense. So it just made sense to be able to turn this into seniors units as quickly as possible. And saying that, we're looking at renovating much of the building, obviously, to suit the purpose of housing seniors. We're not going to wait until it's completely done before we start marketing units. Given the fact that there's 100 units, we'll be able to move seniors into some of those units when they're ready, while others are renovated and prepared. For example, we're looking to install an elevator, so likely won't be moving people into the second floor until that elevator is complete. We did conduct a pretty thorough due diligence when it came to purchasing the building. We had multiple assessments completed, including from the current owner at the time. In addition to our own, we had the property appraised through a third party. And, given the fact that we have a pretty robust housing department and we're pretty good when it comes to property management, considering the scope of the properties that we currently own and manage from Matheson to Moosonee in 13 municipalities, pretty good assessment and ability to assess the property to make sure it was a good investment. Just some bullet points on the left there outlining what some of the rentals will entail. As I mentioned, an elevator, also approximately 8 fully accessible units. The kitchen does require some upgrades, but is actually operational, can be operational in short order. We will be bringing in specific professionals to make sure all the appliances are up to speed and make upgrades as needed. Life safety system upgrades, considering we're going to be purposing this for seniors, we want to make sure we have all of the appropriate life safety systems in place. And then also, not an unimportant aspect is to be able to make sure we can market this property, not only to seniors, but their loved ones who want to make sure seniors are living in a comfortable environment. We do need to upgrade the aesthetics, the common areas, make sure this is a comfortable and pleasing environment for people to live in. So all of those things will be taking place within the next 12 months, looking to have cost estimates finalized within the next 2 months. Just to speak to the points on the right, you can see just some examples. Cadence is a seniors home that we built brand new in Cochrane back in 2014, I believe. And that's only 28 units. And you can see that came in at $322,000 per unit. It was about $10 million construction, just over. And we're actually expanding that. Now we're going to add another, I can't recall how many units actually we're adding, but shovel will be in the ground later this year. And that we've had to subsidize that particular project to the tune of about $250,000 a year. But we're in this business for the long term. We're not in this business, as a lot of developers are, to build, recoup investment, sell the property, whatever. We're in this business forever to be able to provide affordable housing. And so the board at the time in 2014 took the long-term view to this and incurred the additional cost for a common space, a larger kitchen, a larger dining room than 28 units would require, knowing that someday we would be able to expand. And so this year, with that expansion, that property will now turn a profit and be able to take advantage of that increased space that was originally built. And then if you look at another proposed project, which unfortunately is not going to proceed right now, was an expansion to our Sterling Seniors project. So if anybody's familiar with the south end of Timmins, it's the large 6-story seniors building on Sterling next to the school. And that property in the back would have accommodated an additional 60 units. Currently, there's 60 units there. It would have been a large project, 120 units. But that would have been new construction in a public-private partnership that we had with a well-known builder. And the cost per unit for that project would have been $437,000. So immediately you can see the financial benefits when it comes to converting 100 units in the property at 1800 Riverside Drive, which we would anticipate after the cost of renovations plus the purchase price should be under $150,000 per unit. And the reason that's important is not only because the DSAB uses property tax dollars, but also provincial grant money or existing funds that we have. But the further we can drive down the cost per unit for a seniors unit means we translate that right into the rent that we charge for the senior living in the building. And so obviously, again, it's hard for private sector landlords to be able to do that, given the fact that they have to generate a margin that will, put money in the bank and justify their risk. We don't need to generate that same level of margin. We just need to generate enough to make sure the building doesn't lose money and has enough for future capital requirements. And then this is a point I mentioned at the beginning that I know is important to the Timmins business community, in particular chamber members. And it's worth highlighting that in 2024, the Cochrane District Services Board contributed more than $27 million to local businesses and organizations. And that's Timmins specific. I'm not sure. We tried to look at how many chamber members benefited, and we may be able to get that data if we do a deeper dive through our finance department, but stay tuned for that information. And then also in 2024, Cochrane DSAB paid more than $1.5 million in property taxes to the city of Timmins. And so long and the short of it is the city of Timmins pays just over $12 million to our levy. About $20 million of that is municipal, and the other $80 million is a mix of provincial and federal, mostly provincial, for all of our programs. But when you look at it at an investment from the city of Timmins of $12 million, the DSAB takes that and turns it around to an over a 2-to-1 ratio on how we benefit local businesses. And that's not even including the people that we serve through our programs. So opportunities and next steps. One of the things that was always priority for this facility, regardless of whether it was going to be a hard hub or if it's going to be seniors units, was about employment and training opportunities for those things listed on this slide: culinary, housekeeping, maintenance, personal support workers, you name it. Because this is one of the other services that we provide through our Ontario Works and our Employment Ontario services. So it's important for us to position this in a way that not only seniors get housed, but they get supported properly, but then also to create employment opportunities that the rest of the community can potentially benefit from by training and retaining professionals in other service areas. And perhaps they stay and work in this facility, or perhaps they just get trained at this facility and they work someplace else. We all know now the challenges associated with filling a lot of these roles. And so that's why it's so critical to be able to make sure this particular facility serves as a platform for developing that capacity. Also important, that's no small point to be made on the third bullet there, is providing an environment where seniors choose to stay in Timmins. One of the examples I've used in conversations with ministers in the past is, you know, a lot of people, young people move away from Timmins at some point, but their parents stay in Timmins. And when they experience a fall later in life, maybe it's, you know, a fall severe enough for a broken hip, rarely do they have the choice to remain in Timmins. Immediately, their next of kin or their children move them to a place closer to home in Southern Ontario. And so the more we can build seniors facilities where, you know, health services could be leveraged through either home care supports or a third-party provider, the better odds that there are that seniors choose to stay in Timmins and can stay in Timmins, and thereby support that employment niche, which includes personal support workers, healthcare aides, mobility aides, you name it. We want that capacity to stay in Timmins. So next steps, as I mentioned, we're finalizing the design. We have a planner in the works having conversations with the city of Timmins, talking about the zoning, which from initial discussions, we believe is in compliance with the intended use. Also, we're completing the stakeholder engagements with several service providers in the city of Timmins to be able to position this as a place that seniors can receive supports. Maybe some background on that. When we originally built the Cadence facility in Cochrane, we consulted with, at the time, it was the Northeast LHIN, and had good response. But then when we delivered, put together the service plan and delivered light housekeeping, 3 meals a day, medication queuing, not administration, it came back that we were providing too many activities of daily living. And so seniors did not qualify for the depth of supports that they would otherwise if they lived at home. So we want to try to avoid that in this case and be able to position this facility in a way that healthcare providers can come in and provide the supports on site where people live. Again, DSAB, we don't provide those supports. So we want to make sure that when a senior may move in here at 60, that they can stay here until into their 90s. And then, you know, when they turn 85 or whatever the age is where they start to experience some health challenges, that they can stay and still receive the health supports that they need. So we will be securing the appropriate permits and proceeding with tender and contract selection later this year. Before I go to questions, I'll just let people know that, because I've had this question before, you know, does the Cochrane DSAB prioritize local vendors? And absolutely, to the point where Our buildings in CAP, we tender those for services by vendors in CAP. Same with Iroquois Falls, Cochrane, and Timmins. And then if there is no local capacity, then we still keep it district. So, for example, if we need a service that isn't provided in CAP, we would come to Timmins or look to Cochrane for somebody to provide that. And then if there is no district service, we look provincially, and then if not provincially, nationally. So fortunately, we haven't had to look internationally with the exclusion of ambulance chassis, but for the or even some AEDs or equipment through ambulance. But from a housing perspective, the preference is always local. So with that, I will turn it over for questions. If there are any in the chat, happy to answer them. And I do have some that were submitted in advance, so I can run through those as well.
Thank you, Brian. I'll try to chat here without cutting everything off. I don't see any.
Okay.
As of right now, but we could get going. I got a couple for you that we could kind of spark conversation. So how will this project be integrated into the broader infrastructure and transportation planning of the city to ensure accessibility for seniors and other residences? Are there discussions with the city of Timmins regarding public transit routes, walkability, and essential nearby services to make this location as accessible and convenient as possible for residents?
Yeah, well, it's funny because I guess the city, through their plans on Riverside Drive, really solved a lot of these issues with regard to this property by extending the sidewalk to the property. I'm not sure what the plans are to extend the sidewalk. I'm not sure if it goes to Walmart yet or if the plans are in for that to happen. If it does, then that's another benefit to this property. Plus, with the development of the transit on demand, that is something that I think is widely used by seniors in our units. So both those aspects certainly improve the accessibility of the property. We haven't had direct conversations with the city about making any improvements beyond those for this property. But as it stands, I think it's improved considerably over the last couple of years with the developments the city's put in place.
What steps are you taking, or is CDSB taking to ensure long-term financial sustainability of the project? Or are there funding or investment opportunities that the business community should be aware of?
Sure. So the first thing we did was we converted a couple of provincial programs from other projects that we had into this project. So to the tune of, I think, just over $600,000 will be available in provincial money to help offset some of the renovation costs. But then we're also advocating through our MPP to the Ministry of Municipal Affairs and Housing for additional streams of funding to be able to offset the cost for the renovations, particularly the elevator for accessibility, which we think qualifies for a number of funding streams. But even if none of that comes out, we had budgeted for this in the line of credit, which will be rolled into a long-term 30-year amortization tool with TD Commercial to be able to drive down the mechanisms that we use through that funding model. Generates a prime minus 5.5%, which is extremely competitive, especially with interest rates falling the way they have recently. And it gets us to a point where we can actually offer, I think, a very competitive rate when it comes to the rent for seniors to offset that cost of money. Like, I have no doubts that this property will, within the first 5 years, break even. And I say within the first 5 years, because one of the things we learned as we develop new seniors units is seniors are very enthusiastic up front. But when it comes to even they'll put down a deposit and put their name on a sheet. But when it actually comes time to sell their home or leave their current apartment, as any of us would, they hesitate. It's a big change. And so even in our budgeting mechanism for this property, we do budget for vacancy loss for the first 3 to 5 years, just given the fact that, even though there is demand, you saw the numbers, 450 in Timmins, people hesitate when it comes to time to sell their homes, and we're really good at showing even somebody that has a house that's been paid off. We have a tool that we use that shows the comparison of their current living expenses, which include property taxes, property maintenance, groceries, you name it, compared to the model where they would live in a unit like this and get 3 meals a day. Again, some of those services like laundry, things like that. And it takes some time, but eventually, Cadence being a good example, we're able to fill that and now have a waiting list of, I think, up to 50 people. Plus, we have a waiting list for the first time, I think, at Spruce Hill Lodge. And so, we know the demand is there, but we also know that we're good at this, and we'll be able to provide long-term sustainability for this unit and make really good use of taxpayer dollars.
And through the presentation, we heard how the 1800 Riverside project is going to help address the increasing demand for senior housing. But how will you be doing this while balancing other community housing needs, such as workforce housing, transitional housing? Are there plans to ensure this project remains adaptable to changing demographics and future housing demands in Timmins?
Yeah, and that's a great question because one of the fundamental risks that we have been talking about to our board for the last 25 years while we've been in the property management game is making sure that all of our properties can be repositioned. Given the fact that, if we were not capitalizing on seniors, we know the rate, the population in Northern Ontario is aging at a rate faster than the provincial average. So we know there's a demand for seniors housing. So we're capitalizing on that particular demographic to take advantage of this property because we want to turn it around quickly. That said, we also know that if we don't put in or take advantage of the proper economic development strategies as a community at large, which includes all of the vendors, the private sector, large corporations, the city, our healthcare sector, that our population will remain stagnant, which means eventually possibly decline. And we don't want to be the caretakers for empty properties because we still have to maintain these properties, whether they're full or not. And without rent coming in, that just means we'll be a larger levy on the tax bill. And we don't want that. So we're working with community partners to make sure that we're actively engaged in economic development strategies, but as I mentioned earlier, also in employment strategies by making sure we provide opportunities for people to not only fill jobs at the DSAB or DSAB properties, but learn in those environments and get trained in those environments and become professionals in other institutions. So in terms of being able to convert the building for future uses, should the demand for seniors housing not maintain, although that's really doubtful given what we know about the demographic. I mean, again, this is something that the DSAB is well suited to. I mean, we have an internal operations and construction crew that can do some of the work, but then we're really good at tendering for local contractors to make any renovations that would be required to make any changes to any of our properties, not just 1800, to be able to serve a different clientele or a different population. In the short term, we are still actually taking bookings for 1800 Riverside Drive for some contractor bookings. Like, for example, there are vendors that do summer work that staff up, and we're actually taking bookings for that. And we're actually taking bookings for the mining show. And the only reason we're doing that is, again, to make good use of the facility and generate some revenue to offset the costs that we're incurring right now, which is just prudent to make the best use of tax dollars.
Very good. I don't see anything in the chat yet, but if there's anyone on the call that wishes to go off mute and ask a question, feel free. Someone raise their hand. Chris from Radio Canada.
Yes, hi. Just wanted to ask quickly, as far as timeline goes, the goal is still to open doors January 2026?
At the latest. I mean, we'd really like to house seniors in there in the fall if we can, but we know that delays, a week's delay up front usually results in about a month delay at the back end. So given current estimates through our current architect, yeah, I think realistically we'd be looking at January.
And aside from the current funding being put up provincially, what is the part taken up by the DSAB currently?
Well, right now through the arrangement that we have with TD, because again, TD's been a really good partner with us for the last 15 years. And they understand the business that we're in. And so when it comes to securing dollars, we actually don't have to leverage any of our other properties or securities. We just do it on a promissory note. And so the ability to do that doesn't hinder our financial statements in any other way. And which is important because when we go to look for additional provincial funds or federal funds through CMHC, not having any other hindrances on your books is always a good thing. And so right now we've got a flexible line of credit until we're able to define exactly what our costs are. And then all of those costs, including the purchase of the building, will be rolled into the tool that will be amortized over 30 years. So right now we're just paying the carrying costs on the debt on a monthly basis.
So when should we expect a more solid number?
Well, hopefully our architect is on the line here and hears that question and can reinforce the urgency because it does come up at every board meeting. You may be aware that Councillor Black from Timmins asked that question at the last meeting. And to give us some cushion, I said, we're hoping to have final estimates within 6 months, but actually I think we're looking to expedite that and have final estimates on renovations within the next 2 months.
Great, thank you.
Any other questions on the call? Not seeing any. So as we conclude today's session, I want to extend a sincere thank you to Brian Marks and the team at CDSB for providing these updates on 1800 Riverside. Ensuring that developments like this align with the needs of our community, socially and economically, requires open dialogue, and we appreciate the opportunity to facilitate this conversation. Thank you all for your time, questions, and participation today. If you have any further thoughts or ideas, we welcome your feedback. The Chamber remains committed to ensuring that the voices of our business community are heard on key issues like this. Keep up to date with the Chamber's many events, networks, and policy work through our social media channels and website. Thank you all for joining us today and have a great rest of your day, everyone.